Minister, in May of 2021, your department published a piece of research by NUIG, and this research admitted that the long-term impact of puberty blockers on young people's cognitive development, their fertility, and other outcomes remains, quote, largely unknown. That research also said that concerns exist around the potential adverse impact on bone density, cognitive development, fertility, and growth, and that lumbar mineral density decreased significantly in all but one study examined. So, can you explain why for years Irish children have been receiving transgender hormone treatments that your department's own published documents are saying is potentially risky with unknown health effects?
Well, I'd always be guided by medical advice in terms of any sorts of treatments for anybody, including treatments for children, for trans children. And I know medical guidance and medical research changes over time. I think as a department and indeed as a government, we'd always be guided by the best and most up-to-date health advice in terms of what sort of supports we should provide. But I think we all recognise that as a state we need to do more in terms of providing better healthcare to trans children. And that's certainly something I know Minister Donnelly, Minister Butler, myself and indeed both the Taoiseach and Taoiseach have spoken in favour of.
But Minister, respectfully, that a document that was released was just 2 years ago. It was in 2021. Are you saying that there's been long-term studies done in the space of 2 years? I mean, does that make a lot of sense?
What I'm saying is we are guided by medical advice in terms of our approach to what healthcare supports we provide for everybody, including for trans young people.
So were the claims in that research incorrect then, or are you disputing them?
No, I'm not disputing them.
So there is no long-term assessment then for the potential health effects on these kids still?
I'm saying we continue to be guided by the best available medical information in terms of healthcare, including for trans young people.
Minister, just for